Health coming into the council, I think there was a real kind of shift in thinking about how is place a key determinant of health, and what are the systems, what are the public health systems, or general, what's the wider system in place that actually is improving health or trying to improve health. And what is currently, when we're thinking about devolution, what's currently in national control that actually would make more sense to be done locally? What are the ways that we as public sector working locally and nationally need to transform to actually bring about more effective change locally for people, for our residents? How do we shift what we're doing? How do we shift our thinking to prevent ill health from actually happening? A lot of our systems are set up to rescue people when it's all gone horribly wrong. So how do we shift our thinking to prevent that happening in the first place? How do we help? How do we provide help so that people help themselves? And if they need a bit more support, we are there with our public health, with our public sector system to do that. So I think that's very much the conversations that we are having in Haringey, and really thinking about how do we do prevention, how do we do early help more effectively and efficiently locally. As a borough, we had that really strong political commitment to that from the leader and from cabinet and members. And so I think when the opportunity came along with devolution, Haringey was absolutely there to put up our hands, or as somebody said this morning, put our heads above the parapet and say, we'll be a prevention pilot. Don't know what that means, but we're willing and happy to kind of go along and explore with you all what that actually means and what we can do, what we could do differently. So then we started saying, well, so if we look at what the key issues are in the borough, what are the systems at place locally and nationally that we think really need improvement or could be improved to deliver more for our local residents? What might be the powers that we, the politicians, what do the local politicians need more of to enable them to shift the place to be a healthier place for people to live in? So we had lots of conversations with people locally, regionally in London, and drew on the London work considerably and across the different boroughs. And then also nationally with partners. And we looked at, actually it was quite interesting because we came up with a list of things that we could already do at a local level, but perhaps weren't doing as well as we could do. So that was good. So some of that we've got on and done better, or doing better. And then we also were thinking of, well, what more could we do? Given our capacity locally, we also were conscious that we just wanted to target or look at a few things. So the two main areas, one was around sustainable employment and the other is around creating a healthier environment. So if I can just briefly set out some of the things that we're looking at in terms of those two work streams. So under sustainable employment, we know the importance of the interaction between work and health, employment and health. And on balance, it's a really positive one, on balance. So we were, there are quite a few areas that are looking at people with severe and enduring mental health problems and work, RPS schemes and so on. So we didn't want to do that. We're looking much more at the prevention, early intervention side of things. So that's when people go to the GP, having a bit of stress or struggling at work, and the GP says, okay, well, we'll sign you off then, take time off. And what happens in terms of those people and how they might progress on to ESA and being long-term unemployed. So it's those on the cusp. So we're very keen to look, so obviously the GPs are key partners in terms of this, and it is about looking at what their role is in that system. So it's going back to what's the system that we work within amongst the public sector to support people to not fall off the edge, that they get the help that they need at that point. And what kind of help is that? And which are the group of people that would most benefit? So how do you segment that population? And how do you access them? How do you help them? There is a national scheme called Fit for Work, but most people, or GPs, I don't think, know about it. And certainly in Haringey, only one GP has referred into it, so we know that much. So if the system is designed nationally and then implemented nationally, does it have any impact on the ground locally at all? And that's kind of our question. And that's what we're working with the currently the national provider of the Fit for Work scheme, with DWP, with Job Centre Plus, with obviously the GPs and CCG, to look at how could we design the system better. So that's our system example. The second one, and I know I'm out of time, is around healthy environments. So the two key major issues around alcohol and tobacco, what more can we do? We're obviously doing a lot locally already. What more can we do? The two key areas, we're looking at health as a fifth alcohol licensing objective. We're wanting to run a simulated licensing committee, bring in the councillors, the members. London School, Hygiene Tropical Medicine is going to help support the evaluation of that. So make it real. What do local politicians need? What extra powers do they need to make Haringey a healthier place? The second one is tobacco. I don't know if you're aware, but anyone can sell tobacco. You don't need to be licensed. You can have your license taken away if you mis-sell tobacco. So we're wanting to look at, so can we build a case to make it a more positive, in other words, proactive, you have to have a license to sell tobacco regime. And then the third and last big area we're wanting to work on is around gambling, which is quite new. We don't really know what the health harm and damage is. It's highly unregulated. It's regulated if it is nationally. Any research is done nationally. And we are saying we need to have that local knowledge, that local insight, because we want to know what's happening to our local residents who live very complex, complicated lives, and find ways to game and get around all sorts of things that are thought a good idea nationally. So how can we change that and influence locally? The fixed odds betting terminals, where you can lose 100 quid every minute or so, it's unbelievable. So we want to look at kind of hours of operation, licensing powers, local levies, and so on. So that I've set out quite a lot, I think, linked to what we're all setting out about sharing, collaboration amongst the systems, co-developing. We need to engage with local people through the politicians and through research, and build a business case for what of these strands will we really be able to take forward, and take forward with other partners across London.